Welcome to the American College of Surgeons Bulletin Brief from the Frontline Surgeons Voices. With me today, I have Dr. Sharon Stein, and Dr. Stein just completed her term as president of the Association of Women's Surgeons. Welcome, Dr. Stein.
Thanks, Dr. Wexner, for having me.
Great to have you here. Your organization has done fantastic work, which is very important that we support. I think it's sometimes easier for people to support things if they understand it. Realizing that many of our viewers and listeners are not general surgeons, they're in different specialties, neurosurgery, ophthalmology, otolaryngology, they may not be as aware. So I'd like you to start out by telling us a little bit about the history of the association, dated as we see from your virtual backdrop to 1981. A little bit about the history and the current status of it, and then we can go on to some other topics.
Perfect. Thanks so much. So the Association of Women Surgeons was actually founded by Patricia Newman and one of the past presidents of American College of Surgeons. Um, Dr. Newman had kind of gotten together with a couple women at American College of Surgeons meeting and realized that when she walked into the exhibit hall, things like that, she was asked, do you want to buy this for your husband? And think, just not really recognized at that time as a surgeon. And so 40 years ago, next year, she started an association particularly for women surgeons. And it's not just for general surgeons. We include women surgeons of all different subspecialties. The idea has been really to have a place where we can talk about the issues that affect women surgeons. In some ways, those are things you might think about, like pregnancy and maternity leave and things like that. In other ways, it's been really instrumental at really changing leadership around the entire world of surgery. I remember very clearly hearing different leaders talking about that was a great opportunity for them to network, to meet other women who were already established, who could help them with their careers. I myself have benefited immensely from that. And it's really just kind of a community of people who are fighting for the same things, which is equality within the world of surgery and giving opportunity to a diverse group of people.
Well, thanks very much. It's certainly a critically important program, and I remember when I started around that same time you're talking about with Dr. Newman. I started in colorectal surgery, seeing similar things at the meetings from the Colorectal Society as well. So from that growth or the inception of the growth and subsequent growth from 1981 to now, what is the current size of your membership and the scope of your members? Are they all different disciplines within surgery or strictly general surgery? Maybe you can give us a little bit of information.
Absolutely. So it includes women and men, and you're welcome to join as well. Lots of men from around the country and actually even around the world. We have members in about 40 different countries. We have over 3,000 members, and we include different subspecialties. We have neurosurgeons, we have orthopedic surgeons. We have our first OMFS person who's joined Association Women Surgeons. We also have allied members, people who are really affiliated with the causes that we believe in, but may not actually even be surgeons. We have a bunch of medical students who do an amazing work throughout the association, residents, people, all different types of people. And so it's anybody who is interested in creating diversity within surgery, anyone who's interested in making sure that women have equity within surgery. And they can be members in lots of different ways. We just had our largest ever, the virtual format was really exciting. So we had our largest ever meeting with over 500 people at the meeting.
Fantastic. Congratulations. Well, I've just learned something. I didn't realize I could join. So
Yeah, I'll look forward to your membership.
no question whatsoever. It's important that I join.
Thank
But realizing that, my pleasure. Thanks for the invitation. But
you.
but in addition to me learning, many of our listeners and viewers are out of the U.S. And if you could just tell us OMFS so that there's some clarity on the abbreviation.
Sure, oral maxillofacial surgeons. So the idea is that people who are within surgical subspecialties, all there. I think we're all working for the same things. In fact, women in cardiothoracic surgeon, women in orthopedic surgeon, women in neurosurgery may have a lot farther to go than we within general surgery and general surgical subspecialties do in order to get equity within their fields. And so I think by kind of binding together and helping each other out and getting best practices and learning how to kind of overcome some of those glass ceiling issues, we can all do better. It's been really it's enlightening. We're willing and happy to learn from all different places and to share what we have learned with people from around the world. Just like people in different specialties are in different places. I know you've done a bunch of work over in the Middle East. You know, in different parts of the world, we see very different opportunities for women surgeons. And so that's something that, again, we can take our best practices and help them adapt those to whatever environment they're in.
Thanks. Much as the college has local chapters and international chapters, is there any similar recipe for AWS?
It's a little bit different, just from what we actually have is regions within the country, and you can have a region overseas. We have medical student chapters that are affiliated with the Association of Women Surgeons, but it's a little bit different. Um, People can join as an individual. You can also have an institutional membership where you pay to allow all your residents, both male and female, again, to join the Association of Women Surgeons and then get the benefits of membership as well.
Thanks. Now, I know that you had many great initiatives, and one that came across my desk with the Board of Regents and my job with the Board of Regents was a statement that you largely helped craft, I believe, on parental leave. And if you might be able to give us some insights into that and or other projects that AWS has contributed to help surgeons around the country and hopefully around the world.
Yeah, a lot of different projects. I think probably the ones that are most exciting. We do work within advocacy, and we're really strengthening our relationship actually with American Journal of Surgery. They've been really wonderful at allowing us to create opinion pieces and to get information such as the parental leave policy piece, uh, to get a lot of information, not that one in particular, but a lot of information out. We've done work on pay parity. We've done work on parental leave. We've done, and we just published an article, probably the first, I believe, the first article on intimate partner violence, which affects women disproportionately within the surgical community. So there's a lot that we're doing in the advocacy space, but I think although those works are really important, I think what's at the heart of the Association of Women Surgeons is really the things that we do that are more hands-on for our members. We created a coaching program along with Carrie Palmara at Massachusetts General Hospital. We're now entering our third year, where we've actually trained coaches who are practicing surgeons of all different specialties to coach residents across the country using Zoom technology before COVID and before that was really a big thing, to teach them how to coach people, which is a little bit different than mentorship or sponsorship or role modeling. And that's been a really effective program. We have programs teaching people how to be better speakers, our signature speaker series, which has taken 10 women from around the country and trained them to be expert speakers where they are. We have visiting professorships in our own visiting professorships, where we sponsor 2 a year through our foundation, as well as visiting professorships that we share with the Society of Black Academic Surgeons, with the Society of Asian Academic Surgeons, and we're looking to build further partnerships with different people. So the idea is really to take women where they are, to give them the skills to be able to thrive, and then to send them out into the world of surgery and give them opportunities to show kind of what they have.
Excellent, excellent. Very, very important work indeed. And certainly we look forward to a lot more projects in the future. Are there committees if people want to get actively involved besides for the annual meeting? If somebody says, gee, I want to do more than just show up once a year?
Absolutely. And I do think it's one of those associations where the more you give into it, the more you benefit. I really think it's those relationships that you make with other people from around the country from different specialties who become your good friends and allies who you can lean on at times when you need someone to lean on, who kind of are going through similar experiences. So we have committees, we have a membership committee, we have a clinical practice committee, we have a publications committee, grants and fellowships, a bunch of different committees, lots of opportunities. And I will say our medical student committee is just phenomenal. They do such great work. You may have just seen on Twitter, they just did their annual service day where they were taking, even during COVID, they were teaching medical students from around the country were teaching high schoolers about how to sew, and they were doing virtual courses for them. It was just amazing to see what they've accomplished.
Oh, that's fantastic. Many surgical societies have members who are not necessarily surgeons. For example, the Association of Coloproctology Great Britain and Ireland includes pathologists, radiologists, others who are allied. Does AWS similarly have any category for gastroenterologists or whoever?
Yeah, they can, if they're not right, we are limited to surgeons as full members, but we do have a wide, our definition of surgeon includes people such as I mentioned, oral maxillofacial surgeons, people who may or may not even have an MD, a DO, all of those types of things are all included within that surgeon category. In addition, for people who aren't surgeons, we do have an affiliate category as well.
Yeah, that's the one I was wondering about, the
Yeah.
affiliate category. So you're clearly as interdisciplinary as the college in terms of the various surgical specialty disciplines, but you also have affiliate membership. So I think that's a great opportunity. I don't know necessarily, but I don't believe that every specialty has as robust and as active and as accomplished a women's society as you've helped create. So that's good that others can join. Any other parting words you'd like to give us today about the Association of Women Surgeons, how we can help, what you see happening in the future?
I think the biggest thing in terms of helping is, our goal is to not need an association of women surgeons, right? That we actually put ourselves out of business, that we can have such diversity and equity across surgical fields that there's no need for a special organization for women surgeons. That would really be our goal. And I think all of us can kind of do better in that sense of promoting women within surgery, finding medical students and residents who are a little bit different, who maybe have different interests than you. And I think in this time, this year, when all the talk about diversity, thinking outside the box about who you can sponsor, who you can mentor, how you can help them become better, be more equipped, and then push them forward and give them those opportunities. I think that that's what the Association of Women Surgeons, that's what our goal is. And I think that whether you're a member or whether you're not a member, those are really important things that each one of us can kind of just tweak a little bit, gives a couple different people an opportunity and make a difference. And then, I'll be happy when we're out of business.
Well, thanks very much. I appreciate your time today and your insights, and definitely appreciate everything you're doing, which is critically important. And yeah, I'd love to see you accomplish your goal. There's absolute complete equity. But in the meantime, there is work to be done, and I'm delighted to help you keep doing it. And I'll send you my membership application.
Perfect. Thanks for having me today.
Have a great holiday.
You too.